welcome to Get Healthcare. This is the first episode of a podcast that we're going to run with Dr. Nick Flynn, where we run through some of the benefits of online GP care in Ireland, and some of the general problems, some of the good bits, and everything in between. So we'll just start off by essentially introducing our company. We're an online GP care company. And I suppose just a question for Nick, what would you feel has inspired the rise of online GP services in Ireland?
Thanks, Flynn. Good afternoon. I suppose the online GP revolution, or the increase in use of online GP services, has, I think, been fueled by a number of things, but principally it's increased access to care. So, like the online consultation, it's those patients, from their home or from a rural location or from the workplace to consult with a doctor. So that has great benefits. So you don't lose time, traveling to the appointment, waiting in the waiting room for the appointment. You have access at a location convenient to you, to the healthcare professional that you need, in this case a GP, to provide the medical service that you need. And that is the big driver. Of course, we saw huge adoption of this technology during the pandemic, and again, there were a number of reasons for that, but one of the principal reasons was because there's less exposure to illness. So you're sitting in a GP's waiting room, you're sitting with five people who have the flu, so you go in with one problem and you may leave with the flu. And of course, the online GP consultations avoid that particular problem. So there's less transmission of communicable disease in that regard. So access to care is the big one, and then the conversion we saw through the pandemic, where people were unable to access the GP service because of risk of spreading a communicable disease, really turbocharged its use. And also, from the point of view of the GPs themselves and regulators, brought telemedicine more into the mainstream.
Okay, very good. So how are these services addressing the challenges of traditional healthcare in Ireland currently? I suppose focusing on the challenges element, people would be quite conscious of some of the challenges in terms of getting GP care or getting access to care. So
yeah, again, it comes back down to some of the stuff we've mentioned already, which is accessibility and time savings. It also, we find in practice, it's very helpful for continuity of care. So, when you're following up with a patient, the online or the video consultation is very helpful. I suppose challenges that we would have had before that we are seeing less now are people's adoption of the technology. So, people use apps all the time now. They use it on their social media. They use it for communicating with friends instead of phone calls. And I think it's important that we remember that the Ryanair generation, so the generation of people who start booking their holidays at Ryanair, are now living into their 70s. So everybody from people in their teens and 20s who are growing up with this technology, right through to people in their 70s, having used the booking services and accessing services online. And it's a change in how we, I suppose, access lots of services over the last 20-25 years. But certainly, everyone now has a smartphone or has access to a smartphone. That makes the technology easier to access. GPs adopting the technology, certainly there's a big move for GPs themselves to support and promote online consultations. And from a GP's point of view as well, we do see that it makes recruiting some doctors easier. Some doctors had similar patients, they will work for 2 or 3 hours from home and work online, whereas they both are unable for lots of reasons, to travel an hour to work for those 2 or 3 hours to travel home again. So we get an increase in the GP workforce as well.
very good. And then can you share some examples, I suppose, of how online GP care would assist people in rural areas in Ireland in terms of accessibility? I know there's isolation factors involved there as well. So
but it's more than isolation, which is certainly one, and we've mentioned that's if you're in a rural area or if you're on an island, for example, telemedicine can literally be a life-saving technology to use. But in, I suppose, more common use, we would find that, when traditional GP surgeries don't have access to appointments, so patients will use an online provider frequently. Also in the out of hours, so when your GP is closed, the out of hours service is running. These services are frequently at capacity with access problems, so patients find difficulty accessing the out of hours doctor, and then they will choose to use an online doctor in the out of hours or in the evening setting. Again, absolutely appropriately for the conditions that they have.
And then in terms of as a system, how do you feel like the online GP care system can complement the existing physical GP care system in terms of reduction of waiting times and I suppose making it more effective and efficient?
Well, there are lots of clinical presentations to a GP which can be managed through an online consultation. Clearly, the most obvious one probably are ones relating to mental health and stress and depression, where the GP consultation is principally a talk consultation anyway, and the physical assessment of the patient contributes less. But we do also see it in other situations where patients have maybe an existing diagnosis like chronic obstructive pulmonary disease, and they have the symptoms of an exacerbation of that, or the symptoms of an infection. They need an antibiotic and they may need steroids. And just by disease pattern and knowing patient and knowing the disease pattern, it is actually possible to consult safely with these patients online. Other conditions which are very amenable to it would be simple urinary tract infections, simple upper respiratory tract infections. These are all presentations that we can deal with very effectively and very safely and absolutely appropriately in online consultations. And in doing so, if we can take these consultations out of the main flow of general practice, then the in-person GP consultations get freed up for other conditions and other presentations where physical examination is needed. And clearly, there are clinical consultations where a physical examination is essential.
Yeah, very interesting. So what makes online GP services an affordable alternative for Irish patients? I know there's a cost of living crisis and inflation currently, and a big issue is in terms of affordability. So how do you feel like it is helping on the affordability side? And then in terms of the quality of care, how do we ensure that the quality of care essentially is at a similar level? So essentially, without sacrificing quality of care, how are we adding to a level of affordability?
So on the affordability question, I think there are two arms to that. The first one is the out-of-pocket cost. So when you put your hands into your pocket and you pay the medical provider, so that be the online GP or in-person GP. And it appears that at the moment the online GP providers are able to provide GP consultations at a rate that is lower and more affordable than the in-person bricks and mortar clinics. This may be due to the cost of running the in-person bricks and mortar clinic, but certainly that seems to be one thing that I'd noticed, that the online GP consultations are more affordable and are cheaper than the in-person consultations. But there are other, I think, significant savings and cost savings for patients when they are accessing online services. So they have less transport costs, so they don't have to get the bus, they don't have to pay petrol, they've got less parking costs. They don't have to pay time off work, so they have less loss of income. And also for some, especially the stay-at-home mums and dads, they may have to get childcare in order to fit an in-person trip to the doctor, and so there's less childcare costs. So I would see that it's more convenient. Certainly, there's less cost to the patient in going to the consultation, so they've got less transport, parking, and loss of income costs, less childcare costs. And at the moment, the online providers seem to be able to provide an online consultation at a cost that is cheaper than an in-person consultation. So I think that's it from a cost point of view. When it comes to providing safe care, there are clearly conditions which can be treated consult around safely online. We mentioned some of them already today, being mental health and simple upper respiratory tract infections and urinary tract infections. Also very safe for follow-up consultations where they're following up and has a patient's condition improved, maybe giving them some results. These are all safe, effective ways of using telemedicine. However, if there are clearly then situations where you should not use telemedicine. So if you think you've got a life-threatening illness, you've got chest, if you've got severe bleeding, if you've got, intractable vomiting, if you've got severe abdominal pain, there are situations where you do require to see a GP or a doctor in person, because in order to fully appreciate or evaluate what the patient's condition is, the doctor must perform a physical examination and perhaps some tests as well.
Okay. Very good. So for us at Get Healthcare, all of our doctors are based in Ireland and are registered in Ireland, have indemnity in Ireland. How important do you feel that this is, that all the doctors are essentially based in Ireland? Do you think that there is kind of an element of local knowledge as well in terms of healthcare?
Well, absolutely. I think so. There's a couple of things around that. I think the doctor being based in Ireland is essential from a regulatory point of view anyway, but for the service that the patient receives, it's very important that the doctors will understand the culture in Ireland, to get into something, to understand the language and sometimes the colloquialisms that we use. So again, very important. Doctors are based in Ireland for this, so there's nothing is lost in translation. So yeah, it's very important. I say that doctors are based in Ireland from a patient's point of view, but also from a doctor's point of view. It's important that they understand how the healthcare system works. So like when an episode of care needs to be escalated beyond the telemedicine consultation, that the doctor who is consulting with the patient is aware that their in-person GP is an option, that the urgent care centres are an option, the minor injury units are an option. And we try and avoid using accident emergency unless it's absolutely necessary, but accident emergency is an option. It's important that the doctors understand how the patients can access other therapies. So how do you access an optician? How do you access a physiotherapist? How do you access counselling? So having Irish registered doctors who are living and working in Ireland, who understand the culture and understand the healthcare system, is a very important part of the service. Through it, patients receive a good service and good outcomes.
Okay, brilliant. And then from an example of like a practical story where a patient of yours actually, I suppose it might have been through COVID, where patients might have started using online GP care, and some of the, I suppose, a positive story from that, really, if you'd have any to hand.
I have to think about that one. Then just give me a second, because I'm sure I have. You can edit me thinking out.
Yeah, we can edit out bits here.
Yeah, let me think. So a patient story from using telemedicine. Well, Joe, can I say that very often, I would say on a weekly basis, I meet people in my bricks and mortar clinic who have used a telemedicine online service for out-of-hours care, and very often when they're using it because they feel that somebody in the family, very often a child, is sick, and the telemedicine consultation is very helpful for reassuring them that the child is not too sick, that this is the normal course of a self-limiting illness, and that they don't need to go to an out-of-hours service, they don't need to go to an emergency room or accident emergency, and to give them advice on how to manage that particular, self-limiting viral illness, without any antibiotics or without going to any other medical services. So I would say that is the most common situation that I come across. It's really helpful because you get worried parents in the middle of the night who can access the service, and the assurance, and they don't use the out-of-hours GP service, and they don't use the accident emergency service, and telemedicine slots right in there in an effective way.
And I suppose from us, from our company point of view, kind of where we'd like to get to in Ireland is 24/7 availability and a hybrid in-person online care system. And from a patient perspective, like, can you talk to the example, like, can you talk to the practicalities and the benefits to them of having that type of a system where there's low turnaround time, high level of accessibility, and I suppose what type of benefits that would offer then to a patient?
Well, the hybrid system, is that the question?
Hybrid and 24/7 support, essentially, for patients.
So look, I mean, the 24/7 aspect is very important. Like anybody who's been a parent knows that having a sick child at 3 a.m. is always a lot more worrying than having a sick child at 3 o'clock in the afternoon. So having access to that online GP in Ireland at that time, during the night, it is critically important, and of course that improves the service. So what was the second part of the question?
Just around the hybrid model, I suppose, the benefits of like having an in-person consult available.
Yeah. Thank you. Yeah. So like as we've been discussing, there are lots of consultations and lots of clinical scenarios where the episode of care can start and finish with an online consultation.
Yeah.
And we see many examples of this, and through COVID we saw many examples of that. But there are times when a clinical examination will be needed.
Yeah.
In order to confirm a diagnosis or rule out a serious diagnosis. A very common one we would have here would be a young person with abdominal pain and vomiting. So it may have tummy upset, maybe from the tummy bug, maybe an appendicitis, maybe something else. But it's very important in that situation to be able to meet the patient, put your hand on their tummy, make sure they're not tender, to check their urine, make sure it's not a urinary tract infection, and to check their vital signs. So there are times when telemedicine will do end-to-end, and there are also times then where it will be a great help to be able to convert the telemedicine consultation to an in-person consultation to gain extra information from examination and tests that the patient may undergo.
Okay, very good. How do you see telemedicine evolving in Ireland over the next few years?
I see telemedicine becoming more and more mainstream. Again, we see it being used more and more. Patients are interacting with technology for all services more and more. As our younger generation become older, it'll become more the norm. So I see it growing. I see it becoming part of, rather than being something that's bolted on to healthcare services, I see it becoming an integral part of healthcare services. And for all the reasons that we've discussed, convenient and efficient for the doctor and the medical practice, convenient and less cost for the patient, scalable, so the doctor doesn't have to be in the location that the patient is in order to get service. So yeah, I see it growing and becoming part of more part of everyday GP practice, always knowing that there will be consultations where we absolutely need to consult in person with the patient.
Yeah, okay. And what challenges do you face, or are we facing currently in the online healthcare space and service, and how do you feel that we're essentially overcoming them?
I think continuity of care is certainly one, and that's, I think, work hard on. So a well-known fact that patients get better outcomes by consulting with one doctor or one medical service continually over time. Access to previous consultation notes, knowledge of the patient's medical history, all of these things make a patient's outcome more satisfactory. And at the moment in the online space, I suppose patients are quite a choice. So in my opinion, it would be better if they registered with one online provider, for example, Get Healthcare, and stay with that provider throughout their health journey. So they built up a file very much in the same way as you would have done with your home GP when you were a child growing up. That provider and that GP who's giving you the healthcare will get to know you. There'll be an institutional knowledge of your health and of your previous conditions, and that will undoubtedly improve outcomes. So I think continuity of care telemedicine can absolutely facilitate that. But I think because there's a choice of providers, it would be, if I was a patient and I was choosing to use telemedicine, I would register with one provider and I would stick with that provider. I wouldn't move from provider to provider. I think, like in our case, Get Healthcare can absolutely provide that service.
Excellent. Okay. What would you say to someone who's hesitant to try an online GP service in Ireland currently?
I think that there is choice, right? So people should use the consultation model that suits them best. So if they really are nervous at others, and they don't want to use it, that's okay. But I would encourage people where they have, where they may have access difficulties to their own GP, they may be living in a remote area, they may have trouble getting time off work, for conditions whereby the online consultation is suitable: mental health, upper respiratory tract infections, urinary tract infections, and even just for simple medical advice. You can consult, you can make an online consultation, and you can have a conversation with a qualified doctor registered with the Irish Medical Council and get that professional advice or professional consultation that you need. And I encourage people to try it where they feel that it might be beneficial. And they won't really know if they like it or not, or glad they tried. And the convenience, patients really come back to us, and the overwhelming feedback is the convenience of the service to their routine and their lifestyle.
Okay, excellent. Thanks so much. That was the first episode of the Get Healthcare podcast, and thanks for running through all the information.